Sharing. And you're live.
All right, so let's just make sure that we have the department's audio looped in here. Here's, we are still trying to connect with the department. And I believe they may be calling in.
Yeah, that's what they've done the last couple weeks.
Yeah.
There we go.
All right. Do we have the acting secretary, Schroeder, on the phone?
Yeah, we're here, yes.
Excellent. All right. We do not have your video act. Oh, there it goes. Excellent.
You put us in the waiting room, Mr. President, if you can hear us.
Yep, now we can.
1 second, Mr. President. We can merge. Webster, is this with the Department of Health video or the Assistant Secretary Schroeder video?
The Assistant Secretary Schroeder video, and then the Department of Health is just in case we need to try to put.
Uh-oh. I think we just lost them.
Nope, they're just need you to unmute.
Oh, it's unmuted. Oh, it's muted. Okay. Well, perfect.
Can you hear us now?
Now we're good. Excellent. All right. Well, let's go ahead and jump in. Thank you all for being here today. We have our weekly check-in oversight hearing, and let's go ahead and just start right away with Mr. Powell from the Office of Program Evaluation and Government Accountability in the Department of Legislative Services. Mr. Powell, take us away.
Hi, thanks for having me. I'll walk through a couple of slides as quickly as I can. Hopefully you can all see those. So just for some background to kind of set the stage, this is since mid-December when vaccines first became available. The number of cases are down over 50%. The positivity rate's down almost 25%, and the number of tests given is also down about 30%. Next slide, Jake. This is the number of vaccines that Maryland's administered by day going back to mid-December. Orange are second doses, blue are first doses. As we can see, the number of vaccinations actually declined last week when compared to the previous week. I suspect that may be because of weather-related issues on Monday and Tuesday. It looks like that from the data, but perhaps the department could speak to that when they have a chance. Next one, Jake. This again, orange shows what we have used, blue shows what we have been delivered and so far is unused, and that gap has narrowed a little bit over the last week. So I think that's positive. Next one. This is new. We've talked to some public health experts. They have suggested that if a vaccine strategy is working, at some point you'll see the death rate decline faster than you'll see the rate of cases decline. And that's because you're vaccinating the right people. You're vaccinating people who are most at risk for being hospitalized or dying from the disease. It's probably much too early to see anything in that data, but we wanted to start tracking it, and we'll track it going forward. We'll also look at how we're comparing to other states as well. This we've seen before. So this shows the number of first doses and second doses that have been given per state's population. The higher you are on this graph, the more of your population has gotten a second dose. So you can see Vermont's higher, West Virginia's very high. The further you are to the right, the more first doses you have given. Yeah, obviously Connecticut, Alaska, West Virginia, and some others have vaccinated a higher percentage of their population, at least with a first dose, than Maryland at this point. I believe we're 44th in total number of vaccination shots in arms per population of the states and the District of Columbia. Next one. This is also a little new. We just wanted to show how we compared to other states over time. And so you can see Maryland is sort of in the fat part of the curve, but a little behind where many other states are. We'll continue to track that and see if sort of how we compare to our peers. We've highlighted a couple of states on there or tried to, that are somewhat similar to Maryland demographically or income-wise, or a couple of other factors that we've looked at. We'll continue to look at that going forward. Next one, Jake. Thanks. This is new too. We just wanted to show, of all the vaccine that a state has received, how much of it has been used as a first dose, that's green, how much of it's been used as a second dose, that's yellow, and how much of it has not been used so far, that's the red. So it's pretty easy to see how we compare to some of our neighbors and some of our peers around the country as far as how we've used the allotment that we are in possession of. Next one. We also wanted to start tracking the ratio of first doses to second doses. Obviously, that started off where most of the doses given were the first time someone had gotten one. That ratio has declined as expected over time. And now I think it's at about maybe 1.2 first doses for every second dose. I don't know where that will go in the future, but I think it reflects the state's strategy to try and get as many second doses as possible. Next slide. Prince George's County is something that we looked at kind of closely this week. I mean, I just want to point out that the overall for Maryland, 7.9% of the population has gotten a first dose. Prince George's County, that's 3.7. I believe they're the lowest county. And 2% of Marylanders have gotten their second dose. In Prince George's County, that's just 7% of their residents. We'll continue to monitor that. I believe they're lowest county for second dose as well, but I'd have to check. Next one, Jake. This is change in the number of doses by racial category. And again, white Marylanders continue to have the largest growth rate as far as the number of vaccinations that they're being given. Next one, please. We just put this one together, so let me move my Zoom thing so I can see it. Looking at the African-American or Black population in Maryland, they're about 31.5% of Marylanders, close to 30% of the COVID cases that we know of. The death rate's closer to 35%. And at least according to internal data, the vaccination rate right now is about 15%. So we just wanted to highlight the disparity that we saw there. Next one. Ethnicity, again, this is growth compared to where we were on January 20th. And for, it's grown more for non-Hispanic or Latino populations than for Hispanic or Latino populations. Next slide. Also, as expected, most of the growth by age group has been Maryland seniors. So you see the targeted groups of 70 and older, 80 and older have experienced the most growth in receiving vaccines. Next slide, please. Finally, we continue to look at efficiency and effectiveness on weekends. I understand that in many health systems, like all the doses that they have available to give are able to be given out on Monday through Friday, but just want to point out that there seems to be some capacity on weekends if the state needs to potentially increase the number of vaccinations they're giving. I think that's the last one. And that's all I have. Thanks for your time.
There we go. Now I can unmute. Excellent. Thank you, Mr. Powell. Appreciate the presentation. Mr. Acting Secretary Schroeder, if you want to go ahead and give us your thoughts for the last week.
Great. Thank you, Mr. President. Thank you, members of the work group. I appreciate the opportunity to give you an update on our progress. We had a number of milestones this past week, and I want to briefly touch on them before we go into questions. As you know, last week we had some very challenging weather conditions, both on Monday and Tuesday, and then on Saturday and Sunday. And despite that, we successfully stood up the Six Flags site in Prince George's County, began vaccinations at the convention center. We're working in close partnership with Prince George's County leadership to provide appointments at the Six Flags sites to individuals on their priority list. We're also going to be standing up a total of 6 mass vaccination sites in the coming weeks. And I'd like to extend a personal invitation to everyone to tour the Six Flags site and the other sites as they come online. Our statewide GoVax grassroots education campaign began running PSAs this week, and the Maryland Vaccine Equity Task Force is ramping up under the leadership of Brigadier General Janine Burkhead, who was on site at Six Flags throughout the first days of the operation. In just 6 weeks since we received our first shipment of vaccines from the federal government, we've gone from 2,000 shots per day to over 22,000 shots per day on a 7-day average. I might add that last week, as Mr. Powell pointed out, we did see a downturn because of the snow, and then we saw snow again this weekend. But one of our other strategies, by opening up the mass vac sites, they'll be open on the weekend, which we want to drive more weekend opportunities for vaccinations. I'd also point out that when we started our first delivery, we had about 15 providers providing access. We now have over 2,000 distribution sites across the state, and last week on Friday, we did nearly 38,000 vaccinations on Friday. We have two priorities. One is balancing speed with equity, and we're accelerating the pace of vaccination while we build the muscle in our infrastructure systems with new capabilities such as our mass vaccination call center, and while ensuring equity both demographically and geographically. So I'll thank you again for the opportunity to meet today, and I'm ready to answer any questions you might have, Mr. President.
Thank you so much, Mr. Secretary. That is very helpful. And I know this last week we did have the 2 snow days, which definitely helped, but it was very promising to see the end of week rates were certainly much higher. I want to kind of touch back, and I appreciate the department's response from questions last week. It continues to be the question that all of us are getting is where do we go? And what is the best mechanism? So can you describe the department's policy, or what should we be telling Marylanders who are asking, where do I sign up? Do I sign up everywhere? Do I sign up in one place? Where do I go?
Yeah, and so what we've been analyzing that question since we got it last week. One of the things we've learned is that people are not making multiple appointments. They're getting on multiple waiting lists, and a lot of that is due to the fact that we just simply don't have enough supply yet. And as that supply starts to open up over the next few weeks, I think people will be able to get better access. We're not trying to discourage people from signing up on multiple waiting lists, but once they get an appointment, we'd like to encourage them to, cancel the other waiting lists they've put themselves on. One of the things that, obviously, as I've said before, we've built this website that is an aggregator and a referral website. So when you go online, you can put in your location, and it'll tell you all of the access points within your general area. And of course, given the supply, people are going to find from time to time that there are no appointments available. Now, the good news is, when you look at our statistics, we're over 85% as of yesterday of the first vaccine doses have been used, and that'll continue to grow or decline, in terms of the vaccines available. And then on Tuesday and Wednesday, the new supply comes in, and then they're able to. So there's a timing issue here. The other thing I'll mention for second doses, we are asking the providers to schedule the second dose when they do the first dose, so people are assured that they're going to get a second dose. And in today's data, as you see, we've got almost 60% of the second doses have been administered. One of the things that happens here is we get a little float in the system because we ship the second doses immediately upon the first dose being administered. There's a 3-week period put in place, and those doses are shipped. If it takes them a little longer to administer the first dose, there's going to be a float. But as we get further into this, we're finding that more and more of the second doses are being administered. So we encourage people to get on waiting lists. But another thing we found out this past weekend is that when we opened up our website for the Mass Vax site at Six Flags, there were 12,000 appointments made within 30 minutes. So folks who had been waiting had put their names into various waiting lists, were downloaded into the technology, and it automatically became aware of the fact that we had all these doses, and they signed up for them. So that was very encouraging. I'd say the only other thing I'll mention, which I think is our biggest challenge and we're focused on, is the jurisdictions where we've got vaccine hesitancy, and we're particularly concerned about Prince George's County and Charles County, and that's why we're working so closely with Prince George's County directly.
On the Mass Vax site.
On the Mass Vax site.
Right now, we should tell constituents, sign up at any place that you can access?
To get on a waiting list, and then as appointments become available, they will be in line to get an appointment.
And then the verification. So one of the things that we've heard, or at least have been reported back, is that people will apply, if somebody, in that the categorizations of 1ABC, what somebody could make somebody eligible, are providers, administrators of the vaccine required to check verification that somebody qualifies in 1A or 1B? Is there any type of validation that happens? Or should there? Is there recommendation that there should be documentation?
Yeah, we encourage them to have screening to make sure that the people are eligible. If somebody doesn't have documentation, we have an affidavit. We encourage people to have affidavits so that people could, in that case, it's an honor system. We're hoping to appeal to people's sense of integrity. But if somebody shows up and they say they're eligible and they have documentation, then we're going to want to put that shot in their arm. But if they sign the affidavit, we would also put the shot in their arm because we want to get people vaccinated.
You don't want to waste any, which makes total sense.
Correct. That's correct.
Yeah. Will there be a review of administrator of the various different distribution entities on whether they are meeting the target of hitting certain cohorts? So, of retail pharmacy versus the local health department, are they sort of tasked with, you get this group of 1A in the county, Giant, you get this group of 1C, or is it all open everywhere, up to each individual administrator to just anybody that's eligible will give?
We are actually, because of the scarcity of the vaccine, we actually are targeting populations. We're working with Secretary Kramer, for example, on independent living. And we're putting lists together of where are all the independent living facilities, because many of them are not on our list for the other long-term care. And then we are going to providers and saying, look, we will give you the vaccine if you will vaccinate these populations. Right. And so we're using our providers to target certain populations within 1A, B, and C.
So some active providers and some passive providers. Is that a fair?
That's correct. So for right now, we're working very closely with the Department of Disabilities. We want to find ways of getting clinics set up, maybe at ARCs, for example. And that's another target population. So we are moving into that approach so that it's not just, we're not just sending out the vaccine.
Open.
We're asking them to do targeted populations.
Great, thank you. All right, we have about 5 minutes, 5 to 6 minutes per senator, and we'll go Senator Rosapep, Washington, Young, Eckert, Lamb. So I'm going to hand it over to Senator Rosapep.
Thank you, Mr. President. Thank you, Mr. Secretary, for joining us. And thank you for clarifying the administration's position is people should sign up every place they can, because that has been confusing to people. And I certainly will encourage my constituents to continue to do that based on your recommendation. First question relates to the shortage issue. Could Mr. Powell put up the chart he had comparing the jurisdictions? Because I was struck by the District of Columbia percentages first, second, and unused compared to Maryland.
I think that's the Pac-Man chart, as I referred to it earlier.
Yeah, it's a Pac-Man chart. If we can put that back up. But basically what it shows is, it confirms exactly what Mr. Powell has said, is we're way behind most states in the country in terms of the percentage of vaccines that we've gotten that we're actually putting in people's arms. I think we're 44th or 41st or some number like that. We're in the 40s of all the states in the United States. And I just looked at Maryland compared to, let me see if I got this right. No, I apologize. The District of Columbia is not what I was looking. Well, West Virginia, we all know, is doing a great job. But you look at these other states, looking at the numbers and talking with folks at the local health departments and also with the hospital systems, it's my impression, correct me if I'm wrong, that you have been telling people, I think you said this last time, to hold on to your second doses, even if you don't have people ready to take the second dose and you have people ready to take the first dose. So it seems like the department is creating an artificial shortage of encouraging the folks who have them to hoard them instead of just in, just out, and putting the second doses in the week it's due. It's not 3 weeks, it's 3 weeks for one of the vaccines, and it's 4 weeks for another vaccine. So help me explain the 175,000 doses that Mr. Powell says we have that are not being used, and why.
So right now we have 77% of all the doses have been administered, and 84% of those are first doses and 60%, 59,
Right.
60% second doses.
Right.
What we do know is every one of those second doses that's been received has somebody's name on it. And what we don't want to do is give it away to somebody else when it's got somebody's name on it. And,
you put the name on it. The federal government didn't put the name on it, Mr. Secretary. You put the name on it. Federal government.
well, but when we give a first dose to an individual, we feel ethically compelled to ensure that that individual gets their second dose. And, it may be a week or two delay in the process when we receive it and when it's administered, but we feel very strongly that when somebody gets a first dose, and we're encouraging the providers who are doing the first dose to administer the second dose, when they get those second doses, those doses are targeted towards individual people who got the first doses.
And that's a policy that you're pursuing that is different from other states in conflict with the policy of the United States government, and explains why we have greater shortages of doses in Maryland than other states do. So I would just personally encourage you to reconsider that. If it should go to somebody's arm. So
Yeah.
think about that.
Thank you, Senator.
Second question relates to the Prince George's issue. Obviously, I live in Prince George's. I represent Prince George's. And yes, I have constituents who are reluctant to take the vaccine, for sure. But I have as many or more who are anxious to take the vaccine. And Prince George's County is 1 million people. It is a mystery to me why Prince George's has the lowest rate of just about everything you're saying. It has the lowest rate of uptake on use of the vaccines. There seems to be more hoarding going on in Prince George's than other places. It has the lowest percentage as a percent of population. What's going on in Prince George's? What's the problem?
Well, I mean, we really think that the vaccine hesitancy has a lot to do with it. However, that's why we're putting so much focus. We've put the Mass Vax site there to encourage. We're working. We've actually been taking the waiting list from the Prince George's County Health Department, and we're calling people. We have a call center, and we're literally calling people and saying, there's an opportunity for an appointment at our Mass Vax site. you know, we have your name, you're on the waiting list of Prince George's County, please sign up for an appointment. And we're having some success there, as we found with our mass vac site. We also, as I said, we have General Burkhead's first focus is going to be on Prince George's County. She's been working with the officials there, and we're gonna turn over every rock. Our original mobile vaccination teams with the National Guard were deployed to Prince George's County. So we're gonna do everything we possibly can. It's not for a lack of doses. It's for a lack of demand, and we've got to get the demand up.
Again, if I might just very briefly, Mr. President, it is not a lack of demand. It is a mismatch of supply and demand. I assure you there is enough demand in Prince George's County for the doses that you have. So I appreciate your efforts to reach out to people. If we can help you in any way, those of us in the delegation, let us know, because I got lots of people who want a dose in Prince George's County. Thank you.
All right. Senator Washington.
Thank you, Senate President. Thank you. And thank you, Secretary. I just want to just second and reiterate my colleague, Senator Rosa Pepp's concern about the hoarding of second doses. I mean, I support and happy to hear that you're encouraging providers to schedule a second dose. I think that that's very different than sort of hoarding and holding back a second dose. I do believe people feel confident if they're scheduled for it, then they will feel comfortable. You don't have to actually say that. So I heard your answer. I just want to second that we try to adhere to policies that are what our federal government has recommended, and also, frankly, what other states are doing. But my first question is actually from a constituent, and they're asking, are phlebotomists at facilities like LabCorp being prioritized? I got a call saying that they were serviced by a phlebotomist at LabCorp in our district, and the phlebotomist said that she hadn't been vaccinated because she and her colleagues weren't eligible. So I'm wondering, is that misinformation? Are you getting the message out, to these testing sites, people who are drawing blood and interacting?
So the phlebotomists are in 1C, and we have been asking providers to prioritize the seniors first and teachers so we get the schools open. But they are in 1C and are in one of the priority categories.
Okay. All right. So
I would also add, if I might, Senator.
Absolutely.
We actually believe we're following federal policy with the way we're handling the second doses. As you know, we had a second dose problem last week because there was a data error and we gave second doses as first doses, and that created a huge problem. We are reconciling that now with our work with the federal government. So I would argue that we actually are following federal policy.
Okay, great. And these are just a couple of follow-ups from last week. So last week, I noticed that you said that you were distributing the vaccine by population, and I noticed that Montgomery County and Baltimore City were not aligned with the percentage. And then I also asked if you would add positivity and death and hospitalization as a part of that matrix, as part of that crosstab. Is that something that you're able to do or that you're working on? Do you have an update on that?
Yes, General Burkhead and her team we've got most of that data on the dashboard, but General Burkhead and her team will be pulling that data, analyzing that data, so that we can make targeted interventions.
So could you, I think last week I asked for an updated chart and our committee agreed we were interested in that, the work group was interested in it, and you promised that you would provide an updated crosstab. So if you could provide that, that would be helpful as well. And then-
If I could mention, I'm trying not to get ahead of General Burkhead. She's actually working on that.
Great.
And as soon as we have it, but I don't want to get ahead of her work.
Okay, so maybe the general can come and report to us if you feel like more comfortable.
That might be very possible. We'll
Okay.
work on it. Thank you.
Great. And then also I had a question about people phoning in to make appointments versus websites. So a lot of feedback that we're getting across the board is seniors that just can't manage the website. This is another thing, my staff, I'm actually sort of deploying staff and getting volunteers because my staff can't handle it to sit down and walk people through appointments. And then your suggestion of having them sign up on 7 different, so this happened last week, had to have a 95-year-old senior in my district sign up on 4 different websites. I had a volunteer do that to finally get him an appointment, which we did, but this is very problematic. So I wondered if another metric is there a way for people to call in for the appointments as well as doing online? And are there comparisons between, who's calling in and who's calling in? Is there, can somebody call?
Well, first, let me thank you for doing what you're doing. We're asking everybody in the state to help their friends and family. So thank you for that.
Right.
But I'll also say that we're concerned about the elderly not being necessarily computer users, and therefore 211 press 2 is a way of getting access to help.
Okay.
And many states use that system.
So seniors should use so people can use 211 and they can make an appointment over the phone.
They can get help finding providers and getting them to help to either a phone number of a provider or if they have an appointment system, they can link them in there.
Can you make an appointment over the phone?
If you call a provider that has appointments, yes. And what we're trying to do is match up the providers with the people who are interested, through the telephone. And as we move down the road, I mentioned imminently we will have a call center for our Max Fax sites. The Mass Fax sites are in the pilot rollout stage, and we're testing our phone system as part of that process. So very soon we're going to have that capability also.
And Senate President, my final question is also a follow-up on the long-term care and assisted living coordination. So how many meetings can you remind us who's coordinating that? That's the Department of Aging is coordinating that outreach with all the local jurisdictions and identifying the long-term care and assisted living facilities.
So let me parse that a little bit. The long-term care and assisted living is being done by CVS Walgreens. What we're talking about there were certain assisted living facilities that chose not to sign up. We're trying to identify them, and independent living. And what we learned through Secretary Kramer is, so we're collaborating. I don't want to say that, they're doing it alone. We're collaborating together. We're using them as a trusted source of information. And what we're trying to identify are the independent living facilities where seniors tend to live together. Okay. And are living independently. And so we want to target those facilities. And then we've started this past week, we've got one provider who's agreed to go into a facility over a number of weeks because there's a lot of seniors there and vaccinate all the seniors in that facility. And we're going to continue that process so we don't miss anybody.
And do you have a deadline when that's happening? When do you anticipate because it's a low bar. You're just saying you want to identify one in every jurisdiction. So how many have you identified and how's it going?
I don't have the number off the top of my head, but it started this past week and it's going to continue over the next several weeks until we get through.
Okay. Well, these questions I'm going to keep asking you about because they're of interest. So thank you so much. Thank you.
Makes sense. Thank you, Senator.
Thank you, Senator. Senator Young, you're up.
Thank you. Have a couple of questions. I'll start with the easiest one, I hope. These mass vac sites you're creating, are you getting extra doses to operate them, or are you taking a percentage away from all the counties to put in those sites?
Well, we're taking them off the top and targeting sites, and then the balance, as you said, are continuing to go to the jurisdictions through the various other channels, either the hospitals, the local health departments.
So the jurisdictions are going to get less than they've been getting because you're directing some to the MAC sites. I mean, you either have to be getting more or you're redirecting.
Well, we just got some more this past week, and over the next 3 weeks, we had 72,000. We're now getting 88,000. So there was an increase of 16,000. So we're using about 14,000 a week for the mass vac sites. So you could say that we're using the increase for that.
So you're expecting that to continue?
Yeah, well, we're going to grow the mass vac sites.
No, I mean, I'm concerned about how many each jurisdiction gets.
Yeah.
If it doesn't grow, then you're redirecting and the counties will get less.
Well, our goal is to put shots in arms of targeted populations. So the numbers suggest that we're getting a lot of shots accomplished.
Okay, it still sounds like you're saying we're going to get less in each of the jurisdictions. You're going to move them where you think you can stick a lot of people. I'm having a personal problem that relates to some of these others. I had my first site down at the state, which was really convenient. I could have had it at the hospital earlier, but I waited. But they gave me a thing to get back in for my next shot, and I couldn't get in. I got kicked off, and when I tried again a couple of days later, they told me to go elsewhere. That's just me, but I know that's happening with a lot of people. You said call in all these places. That's really tough. I mean, I'm having people tell me they're calling all over the place. They're not getting in. And I'm just wondering, like, with the snow we had, I think about 20% less vaccinations were given last week. How are these people getting rescheduled if they're getting booted? And how is somebody back wherever they were supposed to go and they're full? They just go on a search. I mean, it's really inconvenience for a lot of people to have to go to a dozen sites to try to find it. And before you answer the question, I'll just say one more thing and let you go. I was watching CNN at 6 or 7 o'clock this morning. A young woman was on there, I think from Pennsylvania, and they were having this trouble, and she in 40 hours developed a process that's making it real easy for people to get in. And I think she's becoming popular. There are other places calling her. I think you ought to have somebody watch that show and see if you can reach her. It's certainly simpler if somebody can call one place and get directed rather than on their own. Go on the computer 2 or 3 places, try to get on the phone. Our health department does take phone calls. But I'm having a lot of senior citizens tell me how hard it is to get in someplace.
Senator, if I can follow up on your question to make sure, you said that you went to our vaccination site at the state, at the Miller Building?
Right.
And you got your vaccine, and you had the QR code that you,
right,
and it wouldn't let you in?
I got kicked off.
All right, we'll follow up with that because that I know. Yeah, all right.
But I mean, that's me. I'm really concerned about all the other people having problems other places like that too.
Yeah.
I mean, there's got to be a better way. And like I said, I saw this young woman who did it free. She wasn't working for anybody. She developed a program to make it real easy. So if she's that smart, there's got to be some other people that smart, or we ought to get to her.
Yeah. Okay. Yes, sir.
Did you have another question, Senator Young?
That's pretty much, was the drop 20% last week because of snow?
It was the snow, yeah. And even with the snow, we were at 22,000 doses. We're receiving 12,500 a week, and we did 22,000. So we were 10,000 over the allocation. So we're getting tighter and tighter every week. As I said, the first dose, we're at 84.3% of all doses as of today, and 60% of second doses.
One real quick last thing. I think we ought to do some PR work to reach out. If we're trailing with African Americans and Hispanics, percentage-wise, I think are even worse than African Americans in terms of reaching them. So I know there's hesitancy, but we ought to find a top African American athlete, some famous Hispanic or something, to do TV ads to encourage them to do it. We need to reach those groups better.
Yeah, we agree. The governor launched the GoVax program a week ago Friday. We have a large number of trusted voices in the community. People like Freeman Rabowski, who is the president of UMBC. The woman who's actually leading the vaccine team at NIH is a graduate of UMBC and a woman of color. Yeah, we're pushing that, and we've got a large number of trusted voices who are helping us with that. So you're 100% correct.
Try to get the Ravens quarterback.
Okay.
Thank you, Senator. Senator Eckert, you are up.
Thank you very much. Let me get unmuted.
Senator, you were unmuted. Now you're muted again.
Try it again.
There it goes.
Okay, I got bumped off too, and I had to have somebody help me through it. So, I feel like we're in a time warp, and this is survival of the fittest. Those who are health literate get access, and those who aren't can't. My concern is that 2 weeks ago, the allotment to our counties on the shore was reduced to 300. That's documented. All of a sudden, then, as I talked to you last week, the Walmart was open. So all the 92-year-olds that I know that were on the list lined up to go to the health department are still waiting on the list to go to the health department because their numbers have been reduced. But anybody can go over to the Walmart and get their vaccine. They're not discriminating any of the tiers. And my colleagues who've worked in healthcare for a long time have checked into this. And apparently there is no communication or no regard for honoring the tiers in some of those other pharmacies. So I'm going to ask again this week if you would kind of work on that, because folks are furious, absolutely furious in my jurisdiction, because they believe they're being shortchanged when they've been patiently waiting in line and to be called, and yet you can go and wait around the whole Walmart inside out and then be told we've run out. So we've got to address this in a more equitable way. And it's similar to what Senator Young was talking about. And I understand we're going to have the health departments eventually only do the most vulnerable. And we'll put the rest of it out into the private pharmacies. But we're not there yet, because we've decreased at a time when you told us 72,000 to 88,000, but when we went to 88,000, the local amount was decreased. So folks are having a hard time with this. And I just think we need to get it clarified and not tell people one thing so that they're waiting and yet their amount is reduced. Thank you.
Thank you, Senator. All right, Senator Lamb. Unless, Senator Eckert, were you passing that along? Or
Yes, thank you.
okay. Senator Lamb?
Sure. Thank you, Ms. President. I wanted to follow up on the conversation about having a single sign-on portal. And to Senator Young's point, it's not only inconvenient. I think it's really inadequate to not have a more unified way to sign up. I think we're hearing it from a lot of constituents. It's not just mine. You're hearing it all over this call. As Senator Eckert pointed out, it seems like it's the survival of the fittest. We don't really want a game of the Hunger Games going on to try to be able to get an appointment. And so my question then does the department have any intention of setting up a single website where a Marylander can sign on to one site and get on a either unified waiting list or coordinating all of the waiting lists? Why do Marylanders need to go to the Walgreens website, the CVS website, the Giant website, the Hopkins website, the UMS website, the local health department websites, and other local health department websites to sign up to get on different waiting lists, which we are hearing is happening, just to be able to get themselves in line? Why can't there be a single line here in the state for people to sign up?
Okay, I just wanted to make sure I heard your question. So we've been benchmarking the country. There are only 4 states in the entire country that have attempted to organize that way. We're in line with the other 46 of the 50 states. The ones that have tried this are Oklahoma, New Hampshire, New Mexico, and West Virginia. Most of those are mostly white states. And we believe that what we're doing is more equitable. We're also, and we are getting complaints about why are we giving so many doses to the smaller counties, and why are, when we're trying to be equitable across the board. So a lot of this is about supply, not the technology.
So to our constituents that are experiencing frustration, this is just the way it's going to be in Maryland, I guess, that there's no hope to be able to get into one line and one waiting list to sign up at one location to get themselves populated in the right order, so they don't have to go to every single retail location, different healthcare providers, healthcare systems, and different local health departments.
Well,
there's no ability for a one-stop shop.
I don't think that would be in our best interest, because there's a very high risk could create a single point of failure. If we try
right now you have a lot of different points of failure.
Well, no, I would argue that we've got 84% of the first doses have been administered, and there are many appointments, so we are getting a very high rate of immunization in the state. At least our data shows that. Some of the sources that are being quoted, the governors have been complaining about CDC's data being out of sync with state actual data. So I'm usually trying to compare Maryland to Maryland, but as we look at other states, there is a very high risk of creating one website that fails and then the whole system collapses. The way it's set up now, we are getting doses into arms, and it's working.
And I would just beg to differ, because I think you're even hearing from Senator Young and Senator Eckert, who had problems even within their ability to log in for their second doses within their websites. I think creating a single website where everyone can go into, as long as it's done well and supported, is the best way to be able to queue people up in line, versus a lot of people are going to different sites that look different, have different ways of submitting information, get the little circle that keeps going around in some sites, but not the other site. And the variations there are really confusing to people and make it really difficult for people to be able to sign up. And so I think having multiple different sites is actually leading to multiple different points of failure than having one single site where, if it's done well, everyone can get in line.
So I would argue, as I mentioned earlier, and I respect your opinion. I mean, reasonable people can disagree on this matter. But we experienced the other day, we had 12,000 appointments and they filled up in 20 minutes. And they came from all sorts of sources of waiting lists. So I think the focus is really on the supply. We are advocating with the congressional delegation to push the federal government to create more supply. Until we get more supply, this is going to be a continuous problem. But we're optimistic. We see the road ahead as being very bright. And when J&J comes online, we'll have more vaccine. But it's really a supply issue.
So I have no doubt that, you can have 12,000 people sign up very quickly, but my concern is the equitable distribution of that too, that those 12,000 people might be the people that are the most technologically savvy to be able to do that and get there really quickly. That might not be the 85-year-old or the 90-year-old grandmother that we have that isn't quite as savvy in navigating those sites. The other piece about the equitable distribution I'm concerned about is, as Michael Powell pointed out, the Saturday and Sunday distribution too. Are there any plans to increase Saturday and Sunday distribution at some point? Because I think that does lead to inequities there for people that cannot get off from work Monday through Friday.
All right, so let me go to your first question and then we'll take the second question. So yes, we are going to expand weekend hours. That's why we're building the infrastructure for mass vax. Six Flags is going to be open 7 days a week. We're going to be opening M&T Bank Stadium. So we are building more capacity. And one of the reasons, I think you made the perfect argument for why we need to push doses into pharmacies, because they're open 7 days a week. So we're definitely going down that road.
What are you doing about what Senator Eckert was saying about recipients of the vaccine that are not actually following the tiers? Like the Walmart that might be administering to people that don't otherwise qualify based on the state's tiers. Is there any means to be able to make sure that the highest priority people are actually getting it? And that's my concern with this decentralized model, that moving very quickly to, the retailers removes the control from the local health departments, who've done a very good job in being able to ensure that the people that are getting it meet the criteria. By moving to a decentralized model very quickly, you're starting to lose the ability to make sure that the highest priority people get their doses.
Well, as I last week, I think I showed a pie chart. Right now, 90% of the doses are going to hospitals, local health departments, and the long-term care program. We're only giving 3% of the doses to the pharmacies. That's going to be very rapidly overcome by the federal government's program to give more doses starting next week to pharmacies in the state. So I'm expecting, as the federal government starts to surge, they're going to be pushing many doses, thousands of doses to the pharmacies around the state. And then we will still have our allocation with our local health departments and hospitals and federally qualified health centers to target the difficult to reach population. So I think that's just around the corner.
Okay.
All right, thank you, Senator Lamb. Thank you, Mr. Acting Secretary. There are a couple follow-up questions. First, the Montgomery County Senate delegation, I meant to ask this at the beginning and I forgot. Is there a plan for a mass vaccination site in Montgomery County, or is the Six Flags site the DC region site?
I would say the latter. What we've seen so far is we're getting a lot of Montgomery County residents going already to the Six Flags sites. Quite a number of them have signed up for that.
Okay. And then a suggestion, and then a final point that suggestion would be, I think there is a happy medium if the mass vaccination sites did have a single sign-on or in combination with the health departments. I think the confusion from people having some place that is a clearinghouse is just such an overwhelming demand for some way to capture so that people know that they're in the system. I think it's that lack of certainty that's really hitting hard.
Right.
The last sort of question, and this could be something that we follow up with next week, is I'm curious whether the department has sort of a thermometer of 1A1, 1B1, 1B2, sort of we know how many people are in each subcategory and then how much we have vaccinated of each category. I don't know if the data tracks back enough to get to that, but if that's something that's provided, certainly something we'd, sort of now a month in, how are we looking on the 1A1, 1A2?
Yeah, we can pull that together. We've got that
That'd be
data. Yeah, we'd be glad to do that.
Excellent. Well, look, thank you, Mr. Acting Secretary, and thank you, Senators. We look forward to a successful week ahead, and we'll see you in a week.
Thank you very much.
Thank you. Take care.
Take care.